Hello, everyone, and welcome to your orientation for Goel Health. I wanted to welcome you as a future employee here. Thank you so much for going through this whole process thus far, and really just welcome aboard. It's such a pleasure to have you here on our team. So, my name's Elliot. I am the administrator here at the facility, and in an effort to try and expedite and provide that level of comfort when it comes to orientation. What we've done is we've divided up the orientation to where it can just be a recorded video. So you can watch through it and then take a post test when you come in. Now, let me show you what this breakdown looks like. I am going to show you the RN competency checklist. You guys will note here on your screen, I know it's kind of split up twice, but no matter what department you come into this organization, you have to go through a general orientation. And so, whether it's registered nurse, CNA, LVN, cook, EVS, activities, maintenance, everyone has to go through the same thing. So, the things that we'll be covering today is abuse and neglect, dementia management, which falls into abuse. I know it's a subsect here, but they will be covered in the same lecture. Effective communication, residents' rights, requirements and compliance of an ethics program, person-centered care, cultural competency, and then safety and emergency procedures. Now, when we get into safety and emergency procedures, this will be something that you log into your Paychex account, and all these things will be assigned to you via Paychex. And it's a great little training sesh that is provided by our payroll company. We'll talk about HIPAA, which I'm certain everybody's aware of HIPAA, and we will be doing some tabletop exercises pertaining to emergency preparedness. The next section that we'll handle as a group is hand hygiene, everything that pertains to infection control. So standard transmissions and isolation precautions, how to use your PPE. We'll talk about grooming, which is pretty much just a policy review, how we have to keep our hair nice and neat. Hopefully mine doesn't look too crazy today. I don't know. We'll talk about infection reporting when it comes to employees. So if you guys have some kind of an open wound on your hand or something like that, we want to take special precautions when we're preparing food or we're around patients. If you're sick, stay home kind of a deal. And then lastly, everyone's going to go through equipment cleaning. Now, you'll note on your specific orientation packet, you'll see something that says, dietary skills, nursing skills, EVS skills. And there'll be a list of items that you have to go through with your area specific that either Raymond or myself will cover. So without further ado, let's get started with abuse, neglect, and exploitation. What we're going to start off with is a PowerPoint. So I'm going to go ahead and share that PowerPoint now. And here it is there. And I am also going to cut my video feed in an effort to improve our bandwidth. Perfect. So, resident abuse prevention and reporting. I will tell you guys that you'll see a lot of things that say the compliance store on them. The compliance store is a company that we have chosen to partner with that provides an all-encompassing view of everything healthcare related, speaking about quality, procedure, best practices, forms, you name it, they have it. Now, the downside is their company is designed to meet those institutions that have a robust Medicare involvement. Our particular facility here is not funded by Medicare. So there may be some things that don't directly apply. We will see a few things on there I'll give you a brief explanation of them because they may matter in this level of care. But again, we're going to focus on things that pertain to the CLIF, which is the Congregate Living Healthcare Facility. So let's get started. Our objectives. We should be able, at the end of this PowerPoint, to define abuse, neglect, exploitation, and misappropriation of residents' property. We should be able to verbalize procedures for reporting incidents, including timeframes, and identify activities that can constitute abuse, neglect, exploitation, and misappropriation of resident property. Now, I will tell you that Goel does not handle the funds of the patients. We do not take their money. We do not hold on to it in any way, shape, or form. So we're not really going to misappropriate their funds. But again, we're just going to cover these things in the event a staff member, or I'm sorry, a patient gives you $100 bill and wants some, Marlboro Reds. So we'll see. The overview is going to be over resident rights, who are abusers, and the definitions there too. So all residents have the same rights, and it is every staff member's responsibility to ensure those rights are protected. Each resident has the right to a dignified existence, which encompasses the following. The resident has the right to be free from abuse, neglect, misappropriation of resident property, and exploitation. So everyone in this facility is responsible for reporting abuse and preventing abuse. Okay. Abuse is more than just slapping someone across the face. I'm pretty sure everyone understands that. Who may be capable of abusing a resident? It can be anyone. Note the exclamation point there. This includes, but is not limited to, staff members, volunteers, other residents, spouses, partners, significant others, family members, and visitors. Well, what is abuse? Abuse is the individual must have acted deliberately, not that the individual must have intended to inflict injury or harm. So there's a difference. It was intentional, and it is the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting physical harm, pain, or mental anguish. This includes depriving by any individual, including a caretaker, of goods or services that are necessary to attain and maintain physical, mental, and psychological well-being. So, an example, I don't like your attitude, so you don't get to eat. Wrong. That is abuse. You're getting in trouble for that. Okay. Verbal abuse, sexual abuse, physical abuse, and mental abuse, including abuse facilitated or enabled through the use of technology. Wow. No, no bueno there, right? Neglect. Neglect is the failure of the facility, its employees, or service providers to provide goods or services to a resident that are necessary to avoid physical harm, pain, mental anguish, or emotional distress. Exploitation, however, is taking advantage of a resident for personal gain through the use of manipulation, intimidation, threats, or coercion. And then the misappropriation of resident property is the deliberate misplacement, exploitation, or wrongful/temporary or permanent use of a resident's belongings or money without the resident's consent. So you have an individual, we already talked about money, but let's talk about something that may apply to us. Let's say that there's a resident that comes in with a wheelchair, okay? And then you take that patient's wheelchair away from them. You give it to another patient so that they can make it to our daily activities in the bingo hall. And then that also allows the other patient to miss out. Do you see what I'm saying? That is wrong. That's a misappropriation. So let's talk about some examples of abuse and then actual situations resulting in citations. We're going to talk about citations. You'll see F tags and G tags and all these other tags that pertain directly to long-term care homes and things like that. Again, that's one of the things that's a little bit of a downside with the compliance store is that it has a broad, encompassing set of resources that may not directly apply, but we can still be cited as a CLIF. So physical abuse, everyone knows what physical abuse is, right? That's hitting, slapping, pinching, and kicking, punching in the face, right? Not okay at all. Controlling behavior through corporal punishment So, this person's out of control. You're going to hold them down and put them in a chokehold. Not okay. It may be staff to resident, or resident to resident, or family to visitor slash resident. So, I mean, anyone could really perform the abuse. You see a guy out of control and they put him in a full Nelson on the ground. Not okay. Verbal abuse, the use of oral, written, or gestured language that willfully includes disparaging and derogatory terms to residents or their families, or within their hearing distance, regardless of their age, ability to comprehend, or disability. Threats of harm, saying things to frighten a resident, such as telling a resident that he or she will never be able to see his family or friends again. Oh, yelling mean things at a resident. Sexual abuse is probably the one that gets the most headlines, right? We always hear about it because it seems to be the most egregious. So, non-consensual sexual contact of any type with a resident, non-consensual and unwelcome are the critical words. They do not mean involuntary. A victim may participate even though it is offensive and objectionable. He or she may be afraid to resist or may be cognitively unable to consent. Sexual harassment, which is unwelcome behavior of a sexual nature, including to, but not limited to, pressure for sexual favors, sexual gestures, letters, telephone calls, or material of a sexual nature. Sexual coercion, which is the use of intimidation to trick or force someone into having sex without physical force, use of drugs, threats, manipulation. And sexual assault, which is the use of physical force to get someone to engage in sex against their will, which is rape, and it includes vaginal, anal, or oral, and groping. So we have obviously every level of abuse here at Goel Health is considered, um, explicit. You would be terminated on site if you were doing abuse. It is it is so bad, right? I mean, I don't have to explain how bad it is. I think everyone who's watching this video is aware of how bad it is. One of the ways that we try and protect our residents is everyone who's watching this video has had to go through a background check in which we go through a regional and a national level sex offender registry just to try and do an added safety precaution to ensure that our patients aren't subjected to um, something as traumatic as this. Now, I would also ask is that if you are an employee and you see something that may be leading you to believe that, right? We see something, we say something. So we'll talk about the way to report. I would also like to add, and I'll turn my camera back on for this, that both Raymond and I have an open door policy. Now, it sounds pretty bad because I have my door closed as we speak right now, but it's closed so that the sound quality is improved for this video. In general, it's so early in the morning, no one's here anyways. So, open door policy here. And if you see something or you're concerned about something, please bring it to our attention so we can, the best line of defense is prevention, right? So if we could identify something that we go in there and we make the error in advance, or we correct the error in advance, praise God, because it could be protecting one of those individuals. So let's move on. Oh, there's psychological and mental abuse, which would be humiliation, harassment, threats or punishment or deprivation, taking or using photographs or recordings in any manner that would demean or humiliate a resident. So let's talk about some of these actual F tags. I'm going to zoom in on a couple of these. So this is the citation. This is an F600 tag, and it falls under. So anytime you see a number like this, we're talking about our California Code of Regulations, which as nursing homes and LTACs and SNFs and cliffs, you name it, we're held accountable to a certain level. So what will happen is that the state will come in and do an investigation and they'll say, aha, you don't have a governing body, hypothetically speaking here. And because you don't have a governing body, we're going to cite you on this, and we're going to cite you in all these categories. And let's say that it's an A tag, right, for administration. So this is what you'll see in the form called 2567. That is a corrective letter that comes from the California Department of Public Health. Now, the California Department of Public Health may do licensing for California, or they may be assigned to do a Medicare validation. So they run on a little bit of a different spectrum. But at the end of the day, these tags that pertain to abuse pertain to all healthcare facilities, whether you're a two-bedroom house or, a 500, 600 bed hospital. So an F600 tag is freedom from abuse, neglect, and exploitation. Here's an example situation. Resident A has been repeatedly wandering into resident B room at night, cursing, yelling, and hitting resident B. As a result, resident B is fearful, upset, and anxious. She states, I can't take it anymore. I feel terrible. It upsets me. Sometimes I feel like pulling my hair out by its roots. The facility knew this was occurring and failed to protect the resident from verbal and physical abuse. So again, we talked about this. If you guys see something, you tell us immediately, because we will do everything we can to rectify it, before that happens. We should know, during, after, and then again the prevention. So a 603 tag is a resident without cognitive deficits that the facility's DON, so the director of nursing, that would be Raymond, confirmed is able to make decisions about her care and her future, was found to have a wander guard attached to her ankle. Resident was tearful and stated, I'm a prisoner. Staff reported that the wander guard was placed because they were worried she would not return if allowed out for the day, being that she wants to be discharged home. Not okay. And there's a big difference, guys, between a resident that's a runner, right? We have a policy on that you will review. It's called elopement. That's a big fear, is that one of the residents may run out of the building and we have a busy street right in front of the building and they could potentially get hurt. So we do have a very robust screening of the patients before they come in here. We do have safeguards. We have alarms on the doors that notify us if someone's exiting out one of those doors. And um, I just, we want to protect against elopement, but we also don't want to create an environment of imprisonment. So it's not even a fine line. And the item that's discussed here is actually more like the facility is not wanting to lose out on revenue for this patient fleeing. But we have a responsibility for these patients. We need to make sure that they're in a safe environment. And if they're outside, unsupervised, that's a big problem. So the 607, this was a 483 infraction under develop and implement abuse and neglect policies. It says a resident had $200 in purse hanging on her wheelchair, was transferred to the hospital, and when she returned, the money was gone. The resident reported it to the staff, but nothing was done about it. The facility did not have policies in place to address regulatory requirements for reporting misappropriation of resident property and reporting suspicion of a crime. Let's get into the next slide. I'm just going to do one off this. It says a CNA witnessed a nurse at a resident's bedside with his hand under the blanket, moving quickly. Although the facility began an internal investigation for an allegation of sexual abuse, they failed to report suspicion of a crime within specified time frame and did not transfer the resident to a hospital for a forensic exam until 2 days after the incident occurred. So that's reporting reasonable suspicion of a crime. We always see reporting of alleged victims, and then also, actually, you know what? Let's just go through them. Resident reported to a surveyor that she had been cursed out by a CNA earlier that week. Resident was without cognitive deficits and had specific details of what was said to her. The resident had reported to the unit manager, who reported to the DON. The DON acknowledged that it was verbal abuse, but had not initiated an investigation or reported it to the state survey agency, Department of Health, per law in that state. So again, our reporting policy is a little bit different because we're not a Medicare funded organization. So the way that we report, we'll talk about when we get to the tail end of this. Resident had noticeable bruising around her eye, and staff did not know how it occurred. Charge nurse reported that she noticed it but did not document anything on it because there was no incident. But I guess I should have documented it. RN supervisor said she noticed it as well but did not initiate an investigation. So For us, we have a weekly examination for wounds and things like that where we document these things. If you notice a bruise on an arm, a wrist, a neck, face, or something like that, it must be addressed. Following your indicators of abuse, when you notice a resident displaying any of these indicators, some type of abuse may have occurred. So here's a resident, has unexplained bruises, we just talked about that, scratches or pain, presents as fearful, jittery, nervous, and acts submissive, hesitates to talk or is talking less. Won't make eye contact, has vacant stares, withdraws from activities of interest, self-isolates. Shows signs and symptoms of depression, episodes of crying, begins acting suspicious of others, becomes uncharacteristically aggressive and hostile. Sorry, guys. Resident to resident altercation should be reviewed as a potential situation of abuse. Every resident to resident altercation is not necessarily abuse. For example, infrequent arguments or disagreements that occur during the course of normal social interactions would not constitute abuse. In cases where either or both residents have a cognitive impairment or mental disorder, abuse can still occur. Having a mental disorder or cognitive impairment does not automatically preclude a resident from engaging in deliberate or non-accidental actions. It is important to remember that abuse includes the term willful. The word willful means that the individual's actions was deliberate, not inadvertent or accidental, regardless of whether the individual intended to inflict injury or harm. Staff should monitor for any behaviors that may provoke a reaction by residents or others, which include but are not limited to verbally aggressive behaviors such as screaming, cursing, bossing around, demanding, insulting to race or ethnic group, intimidating, physically aggressive behaviors such as hitting, kicking, grabbing, scratching, pushing, shoving, biting, spitting, threatening gestures, throwing objects, sexually aggressive behaviors such as saying sexual things, inappropriate touching or grabbing, and taking, touching, and rummaging through others' property and wandering into other rooms' space. The residents' rooms in this facility are their rooms while they're here. There's no need for another patient to be in there unless as a welcomed visit. Regulations on reporting abuse. So we're going to talk about reporting abuse and the Elder Justice Act. All allegations of abuse, neglect, exploitation, mistreatment, including injuries of unknown source and misappropriation of resident property, referring collectively as abuse for the purpose of this training. All alleged violations involving abuse must be reported immediately, but no later than 2 hours after the allegation is made. If the events that cause the allegation involve abuse and result or bodily injury, so 2 hours, or no later than 24 hours if the event or cause the allegation did not involve abuse and do not result in serious bodily injury. So when these things are happening, you guys need to notify Raymond. If Raymond doesn't answer for whatever reason, I don't care if it's the night or it's the weekend, then you guys got to call me so we can make this full report because we need to do it in a timely fashion. So serious bodily injury is considered an injury involving an extreme physical pain, an injury involving substantial risk of death. Man, we got really sick patients here from time to time, guys. So if another resident pushes another resident and they fall and break something, it could lead to death. So again, we want to be very cognizant of this. An injury involving a protracted loss or impairment of the function of a bodily member, organ, or mental faculty, an injury requiring medical intervention such as surgery, hospitalization, or physical rehab. So we are not a hospital here, guys. So when something like this happens and there is an immediate threat to the patient's well-being as far as like an injury is concerned, we dial 911, get the ambulance here as soon as they can to get them to a higher level of care. Who should receive a report of an abusive allegation? That's me, facility administrator. I need you guys to reach out to me. Okay, the resident's physician, that's Dr. Chan. In this building, Dr. Chan is our primary provider. Okay, the resident's representative, that may be their loved one. If they're conserved, that would be the conservator. It's really relative to who's going on there. Law enforcement. So if there was a crime, we need to call the cops so that they could do an investigation. Okay, the state survey agency. So for us, our state or survey agency is CDPH. And so that would be the reporting that I do. I would do. I would reach out to CDPH in this one here. Nurse aid registry or professional licensing authorities. So if this was a nurse performing the act, let's say it was a respiratory therapist performing the act, someone would have to notify the respiratory care board in the event that this person's license needs to be placed in jeopardy because this could be a repeated behavior. We may need to call Adult Protective Services or any other agencies in accordance with state law. So here is the Elder Justice Act. This is the background surrounding it. Section 1150B of the Social Security Act was established by the Elder Justice Act, also under the Affordable Care Act, which states the facility must develop and implement written policies and procedures that ensure reporting of crimes occurring in federally funded long-term care facilities, which is not us, in accordance with Section of 1150B of the Social Security Act. A federally funded facility is any facility that accepts Medicare and or Medicare payments. That is not us. A crime is defined by the law of the applicable political subdivision where the facility is located. Every covered individual who is aware of a crime or activities that are suspicious of a crime are required to report under the Elder Justice Act. A covered individual is an owner, operator, employee, manager, agent, or contractor of a long-term care facility that receives at least $10,000 in federal funds during the preceding year. Again, this is not us, but we are mirroring the reporting because it's best practice. So even though technically speaking, we don't have to do it, although we do have to report abuse, it's not under these guides. You have the right to know your obligations to report. You have the right to know the penalties for not reporting. In general, subject to a civil money penalty of not more than $200,000, increased harm if the violation exacerbates the harm to the victim of the crime and results in harm of another individual, subject to a civil money penalty of not more than $300,000. In either case, failure to report may exclude you from participation in any federal health care program. You have the right to lawfully report without fear of retaliation. Lawful reporting protections include making a report, causing a report to be made, or taking steps in furtherance of making a report as required by law. So other things that pertain to us as the facility is that we need to establish policy and procedures for preventing and reporting, which we have done. Post a sign specifying the rights of employees under this section, such as shall include a statement that an employee may file a complaint with the secretary against the long-term care facility that violates the provision. So if you have an issue with us or something that, myself or Raymond, let's say, is not addressing, we always have the opportunity to address it. So if something goes to Raymond and he's not addressing something, the next level in the chain of command would come to me. If I'm not addressing it and you feel that there's a concern for the patient, you notify the state. I'm certain that you're not going to have much administrators telling you to do this, but this is the best practice. If you're very concerned that a resident is in harm's way and the leadership at the facility is not doing the right thing, then you call CDPH. And in our area, we would reach out to the Fresno district. And I just would encourage you guys, if we're not doing the right thing and you've given us the opportunity to do it and you're worried about the patient, then you must notify the state. Okay. The facility will not discharge, demote, suspend, threaten, harass, or deny promotion of any other appointment-related benefit of an employee or in any other manner discriminate against an employee in the terms and conditions of employment because of law of reporting. Absolutely. We will not be doing that. And it's the law. So the facility will not file a complaint or report against a nurse or other employee with the state professional disciplinary agent because of lawful reporting. Yes. So what are the staff's responsibilities? What's reportable? Who do you report to? And then protect and comply. Each and every staff member, regardless of position or department, is responsible for reporting abuse. Our facility abuse prevention coordinator is, you see a blank line there. That is me. So that would be Elliot North, Goel Health Administrator. Okay. My office, like I said, open door, you come right in, and I'll show you the form that you will fill out. You must report, notice that must is bold, all allegations and observations of the following: abuse, neglect, exploitation, mistreatment, injuries of unknown source, misappropriation of residential property, any suspicion of a crime. Examples of situations that would likely be considered crimes in all subdivisions would be murder, manslaughter, rape, assault, and battery, sexual abuse, theft, robbery, drug diversion, identity theft, and fraud or forgery. Okay, those are all things that are considered reportable. There was something else on here that I wanted to highlight on, but maybe it'll come to me. Okay, so who do you report to? This is you, the employee. Take immediate action to protect the resident from further or potential abuse. So you guys will never be alone here, okay? Unless there's some wild circumstance that forces there only to be one person here, okay? But you want to separate the two residents. If there's a resident to resident type thing, you're going to separate, or you're going to protect the one resident from the other who's doing the abuse, okay? You're going to report to your immediate supervisor, who will then report to the administrator, and you may report to the administrator as well. So again, you're going to call, if this is happening day or night, you're going to call Raymond. If for whatever reason Raymond doesn't answer, you call me. Okay? One of us needs to answer. And if we're going to continue in escalation, you call the police. If either of us are not answering and there's a fear and there's a threat, call the cops. The sheriff literally is 1 block away from us. If you were to continue down Kiernan, before you get to the Kiernan actual exit that's over there, the police station, the sheriff's right there at the left with the fire department. They share an office. You're going to provide a verbal and written statement of what you witnessed, and you comply with any of our facility-specific requests. So what I'm going to do is gather verbal and written reports from all witnesses and begin the investigation. I'll provide those verbal and written reports to the state survey agency, law enforcement, and any other agencies in accordance with state law. I'll revise the resident's care plan if the resident's medical, nursing, physical, mental, or psychological needs or preferences change as a result of an incident or abuse. So I will not be the one to revise the care plan or the medical treatment. That would be Dr. Chan. We don't have anything to add to this. Okay. Who do you report to? Take immediate action and protect the resident. We've already talked about that. We're going to report directly to law enforcement and state survey agency. Boom. It is the policy of this facility that employees also report suspicions to the administrator designee. That's me or Raymond. And I know it says insert facility specific policy here. If different, our policy is not different. And we'll have an opportunity to review the policies. The administrator facility abuse prevention coordinator designee. Assist the staff member with reporting requirements and ensuring compliance with specified timelines. Remember, we have our 2-hour, our 24-hour. Gather verbal and written reports from all witnesses and begin the investigation procedure. Provide those verbal and written reports to the state survey agency, law enforcement, and any other agencies in accordance with state law. Revise the resident's care plan if the resident's medical, nursing, physical, mental, or psychosocial needs or preference change as a result of abuse or crime. I don't have anything to add on that. It says it remains the responsibility of each staff member to ensure that his or her individual reporting responsibility is fulfilled. Protect and comply. You must do your part to protect the resident or residents involved from any additional abuse. All allegations will result in an investigation, and all employees are expected to comply with the investigation. You will not be discriminated against, nor will the facility retaliate against you for reporting. We've already talked about that. The results of all investigations must be reported to the state survey agency and any other agencies in accordance with state law within 5 working days of the incident. So this is for me, right? So for you guys, it's 2 and 24, and for me, it's within 5. If the alleged violation is substantiated, appropriate corrective action must be taken. Investigation results will be reported to a nurse aid registry or professional licensing board and any other officials in accordance with state law. So if the abuse transpired from one of the staff members who is a licensed professional, we must report it. Not promote. We must report it in an effort to prevent future encounters. So let's talk a little bit about prevention. I think the next, if I'm not mistaken, it's a little less than 8 slides left on the presentation. Let's go ahead and talk about prevention. So we're going to look at vulnerable populations, communication strategies. We're going to understand behavior. Let's brainstorm and then report abuse. So residents with cognitive impairment are at a greater risk for abuse and neglect. This can include Alzheimer's, vascular dementia, Lewy body dementia, Parkinson's disease, Huntington's disease, and any other disease that results in loss of memory and other mental abilities severe enough to interfere with daily life. Remember, residents with cognitive impairment can't help their behaviors. They're having a hard time. They're not giving you a hard time. I have videos for you guys about that, which will be great. When working with residents suffering from cognitive impairments, it is important to remember changes in the resident's brain have caused them to lose the ability to communicate effectively. Listening is about understanding the message the resident is sending through both words and actions. Speaking is about the message you send others with your words, tone of voice, and your body language. Okay? You're yelling with your hands in the air. You're sending a message. And then try and see the things from the resident's point of view, meet the residents where they are. Residents with cognitive impairments can't change the way they communicate. So we must be the ones with change. What can we do? What are some strategies? Identify yourself and call the resident by the name he or she prefers. Be at the resident's eye level and make eye contact. Pay attention to your body language. Pay attention to the resident's body language to see what they're trying to communicate. Use visual and verbal cues to get your message across. Speak slowly, simply, and in short sentences. Give the resident enough time to respond and avoid using negative words like saying no and arguing with the resident. Please don't argue with the resident. Okay. So as a respiratory therapist, one of the things that always has transpired for me is when a patient's on a ventilator, their ability to communicate is challenging at best, right? They no longer are able to speak. So one of the things that we would do is you walk in the door, you knock. Hi, my name's Elliot North. I'm your respiratory therapist for the day, or I'm the administrator of the facility. I just wanted to let you know about XYZ. Are you familiar, or do you understand what I'm talking about? Something along those lines, but in a very calm, cool, collected manner, asking for permission to come in the room because remember, guys, the patient has every right to refuse treatment. Like, get away from me. I don't want to talk to anyone right now. Absolutely, not a problem. Is there anyone else I could send in here that you would be more willing to speak with? Is there anything I could do better or something along those lines? It's all about de-escalation. And for those of you who are onboarded here and you're seasoned, I don't need to tell you about that. But for those of ours that are new grads, you guys have to learn your rhythm, right? And I encourage you to talk with the more senior members about appropriate strategies on going into that patient's room and making them feel comfortable and at home. Because at the end of the day, this is their place of residence right now. So let's go back to that PowerPoint. Okay. Paying attention to the resident's body language to see what they're trying to communicate. Speak slowly, give the resident enough time to respond, and avoid using negative words. Why isn't this moving? There we go. Our negative responses to a resident's behavior may result in abuse. An action is something you do. A reaction is how you respond to your environment. These actions of others or to a situation. Consider the behaviors of a person with cognitive impairment as a series of actions and reactions. They are trying to communicate with you. Evaluate possible reasons behind the action and reactions. When we understand what the person is communicating, then we can determine how to respond. This is the root of person-centered care. We'll be talking about that. Remember, what works for one resident may not work for another. So responding to abuse, we have the SAFE acronym. S is stop. Can you interrupt the chain of events before the situation escalates to abuse? Can you safely stop the abuse from happening or intervene between the abuser and the person being abused? Alert. Be alert and do not get hurt trying to intervene. Alert others with a call button or yell for help if you can't stop the abuse. So the call button in our facility is at the head of bed. Friend. Stop or diffuse the situation by being calm, trying to calm those involved, reassure those involved. An emergency. If you see the situation becoming an emergency or there is serious bodily injury, absolutely call 911. And this is a page for Q&A, but I doubt that we'll have any questions because this is pre-recorded. So on that note, I am going to transfer over to what our reporting form looks like. So I'm going to stop that share. And I am going to close this one out if it so allows me. Whoa, 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 whoa. All right, I'm still here. Now let's open up our abuse and complaint form. You know what? I'm going to make it full screen over here so we can look at it together. Okay, so you'll see on this form here, this is our abuse complaint statement. So these are the things that we need from you guys. We need you to do the resident's name, the room. There's not a unit here. There's just the room number. Okay, date and time of the incident, date and time of the statement, resident's most recent BIM score and MDS. Don't worry about the MDS data. Resident has a diagnosis of dementia or Alzheimer's disease or other diagnosis resulting in cognitive impairment. This is where you would list that. So information of the person making a statement. This is the person for the statement of understanding saying that the following statement is given freely and voluntary without promise of benefit or threat or use of duress. So fill out everything that you can think of on this form as soon as physically possible. After you have, completely reduced the situation, right? We're going to have focus and emphasis on diffusion first and then the form ASAP. Now, let's look at some of the other documents that we have. This is a validation checklist that you guys will go through when you come in the facility. And hopefully it allows me to share that as well. Screen 2. So here is our compliance with reporting allegations of abuse, neglect, and exploitation. These are things that we're going to go over with you as a one-on-one type deal, right? We're going to review the circumstances of the alleged violation. So when we talk to you guys, a validation checklist is basically Raymond or myself standing on the other side with the clipboard and going through this one by one to check yes or no. Okay. And this isn't a major form here. It's actually one of the smaller ones. So that's something that we'll do on a one-on-one type deal. And then our last item, well, it's not our last item. We do have a test, but our last item that we're sharing pertains directly to dementia and abuse. We'll see if it's going to share here directly with you guys. Screen 2, share. Okay. So we see computer's having a moment. I apologize. We see here, this is our poster that you'll see. Oh my goodness. Of course, it's having a moment right now. This is a poster like what you guys saw in the beginning of the video that we'll have posted up there so you know how to identify dementia and abuse prevention. So we'll check that one out here in a second. And then our last thing that we're going to cover today is our test. So you guys will have this test in your orientation packet, and we'll have these questions here. So when we meet in person, we need to go over this so we can have this in your file. So some of the things you'll see here, what does it mean to say to someone, or what does it mean to say someone was abused? Is it the willful and harmful physical or mental treatment of a person? And then we see the failure. A sounds pretty familiar. What does it mean to say someone was neglected? We see the obtaining of a thing of value of a resident, the fondling of a resident without consent, the failure of proper care to be given to an individual, which characteristic of a resident might put them at risk of being abused, and you will see that there is a total of 25 questions, and then we'll go over the answers when you guys are on site. So, with that being said, thank you. Thank you so much for hanging out with me for the last, gosh, 50 minutes on abuse and reporting. And I hope the remaining videos are seamless and we can get through them with a smile on our face and everyone's not pulling their hair out when they look at that orientation packet and said, there's like 25 sections. Your first 8 hours will be dedicated to the facility, the training that we're talking about for general orientation. The remaining 8 hours, let's say the remaining minimum 8 hours, depending on your trade, will be pertaining to your field and its specifics. So on that note, I hope you guys all have a blessed day. If this is where you're going to stop the video and you're going to take a breather, relax, get ready. We've got several more of these videos to cover. Have a wonderful day.